Senate Bill 733 is a bill that would remove provisions of the code that are medically unnecessary and serve as barriers to access to abortion care in Virginia. It does four primary things. It repeals the requirement that an individual receive a transabdominal ultrasound at least 24 hours before the performance of an abortion. It repeals the requirement for only a physician to provide, it repeals the requirement that only a physician provide a first trimester abortion and would allow other healthcare providers, including physician assistants, nurse practitioners, physician assistants and nurse practitioners acting within their scope of practice and in consultation with the doctor. It repeals the requirement for medical professionals to provide biased and medically inaccurate information prior to an abortion. And it repeals the requirement that facilities performing 5 or more first trimester per month be regulated as hospitals, otherwise known as the TRAP laws. This bill coincides with the American College of Obstetrics and Gynecologists' recommendations that recognition that decisions regarding abortion should be made by patients in consultation with their health care providers. The bill also corrects inequities in the law that have disproportionately impacted poor women and women of color who face more barriers when trying to access reproductive health care than their white or wealthy counterparts. I would like to take each provision one at a time. The first section is the section that would repeal the 24-hour waiting period and the transabdominal ultrasound requirement. This requirement is medically unnecessary and frankly useless for over 90% of the abortions which occur in the first 10 weeks of pregnancy. A transabdominal ultrasound really cannot see the fetus or show what gestational age is. Usually in the first 10 weeks of pregnancy, you need a transvaginal ultrasound. As a matter of fact, when I was pregnant for the first time and had to have my first ultrasound, and when the doctor was trying to determine gestational age, I had to come back later because in that first ultrasound, they could not determine gestational age because they could barely see the fetus at that point, and that was with a transvaginal ultrasound. The requirement for medical professionals to provide medically inaccurate information. The bill does not say that we will never have informed consent. And as a matter of fact, informed consent is a part of the medical profession's scope of practice. We do not mandate that in the code for any other procedure, but informed consent is provided. For example, when I had my colonoscopy, I was given very detailed information about the procedure and potential complications before the surgery or the colonoscopy was given. Similarly, when my husband had spinal fusion surgery, he was given pretty detailed information about that surgery and what the risks were. But this code mandates information that is not medically accurate. A 2013 analysis of Virginia's information packet found that 22% of the statements were medically inaccurate, and specifically when pertaining to the first trimester, 41% of the information was medically inaccurate. Again, we should not single out one procedure to mandate specific information to be provided when we don't do that for other procedures. The TRAP laws is repealed. This is the requirement that facilities performing 5 or more first trimester abortions be classified as a hospital. Significant portions of this law, including the building code requirements, have been found unconstitutional and as a result are not being enforced. Again, an abortion procedure is as safe as other procedures that are not required to be done in a hospital, such as colonoscopies, oral surgeries, micrographic surgeries used to treat skin cancer, EGDs, which I cannot pronounce what that stands for, so I won't even try, liposuction, cryosurgery, incision and drainage, and EDNCs, again, another procedure I cannot pronounce, so I will not try. And then expanding the list of professionals who can perform these procedures. This bill would allow physician assistants and nurse practitioners acting within their scope of care or scope of practice and with the supervision of a physician to perform first trimester abortions. The American College of Obstetricians and Gynecologists, the American Public Health Association, the World Health Organization, and a report by the National Academies of Science, Engineering, and Medicine all support allowing advanced practice clinicians to perform medication and aspiration abortions. In a recent court decision, Judge Hudson wrote that the plaintiffs provided extensive supporting evidence at trial that advanced practice clinicians, as well as other similarly trained and licensed healthcare providers, are capable of providing medication and aspiration abortions, which are routine first trimester procedures. 9 states allow these professionals to perform first trimester abortions. And again, these professionals are allowed currently to perform gynecological procedures that are very similar to aspiration abortion in technique and risk, such as inserting IUDs, performing endometrial biopsies, and managing miscarriages using the exact same process used in an aspiration abortion. They are also allowed to provide medications similar to those that are used for medicinal abortion. You were given written testimony from a number of folks, the American College of Obstetricians and Gynecologists, the Virginia Section and National, Physicians for Reproductive Health, the Center for Reproductive Rights, the National Women's Law Center, the National Partnership for Women and Families, the National Institute for Reproductive Health, the National Abortion Federation, the Reproductive Health Access Project, Power to Decide, and Women of Reform in Judaism. And I'm sure there are a number of people here who would also like to speak.